going back to accessing, once we did pull back, we would go ahead and push pause and flush this with 10 mLs of normal saline. And then, for example, now if we were going to be drawing blood, which we are going to demonstrate that now in this video, then we would, well, in the event that there was an infusion running, we would want to make sure we stop that or pause that infusion for anywhere between 2 and 10 minutes, because you don't want any, you don't want that to be diluted. You don't want your sample to be diluted and cause false labs. So we'd stop that for 2 to 10 minutes, and we'd wait. And then we would want to first take 5 mLs of discard at least, so we already have this connected from flushing it. So then we can go ahead and pull back 5 or maybe a little more, just to be on the safe side. We're going to go ahead and pull that back and use that for discard. We will disconnect and put that off to the side. And then we're going to take a scrub hub, and for 15 seconds we are going to clean that port. And discard that. Then we would take our 10 ml syringe, again wanting to use that 10 ml syringe at least for proper pressure when we're going to be drawing that back. And we can go ahead and connect that, and then we would go ahead and draw our sample, whatever the case may be, or the amount I should say may be. So do that, and then we can disconnect, putting that to the other side, making sure that we have that properly labeled as necessary, so we don't get that mixed up with our discarded blood. Then again, we would take another scrub hub, and again for 15 seconds we would scrub. Discard that, and then at this point, if we don't need a continuous infusion or anything like that, we would go ahead and flush. Push pause here. We want to do that with, well, depending on your agency policy, we're going to go ahead and go with Aurora's, and we are going to do that with 20 mLs. Again, these were already prepped, so there's no air in them, so we can go ahead and continue to flush. And then we would go ahead, if we weren't doing anything else, we would go ahead and clamp that. But today we are going to have a continuous, or if there's no continuous infusion, I should say that then you would, per your agency policy, take your heparin flush, and you would go ahead and flush that with heparin. But today we're going to do a continuous infusion. So what we need to do is we need to first dress this. So we will take our bio patch from our sterile field, and we will make sure we put that between the skin and the needle here. It's got nice antimicrobial stuff in there to protect against infection. You want to make sure that the blue is to the sky. And then we take our dressing, whatever we have. In this case, I have a Tegaderm, and we would put that over here, covering that like so, securing that. Typically, we would have a shirt and a pants, and there would be like a little slit there, making sure that our tubing is going through there. There goes my dressing. So then once that is dressed and we need to do a infusion, then we can go ahead and unclamp. And then I would just be on the safe side and go ahead and clean this off again for 15 seconds. And then we could go ahead then, making sure that, like I said, this is unclamped, and we can go ahead and connect our infusion, and then we're good to go. And then once we would do that, or we begin the fusion obviously at the prescribed rate, whatever the physician had ordered. And then at this point, then we can go ahead and get rid of all of our supplies, put everything in the garbage, dispose of it as properly done, and then get rid of these sterile gloves. Hand hygiene. Again, we would have gotten rid of all this stuff as well. Everything would be in the garbage. And then we would go ahead and document. We want to make sure that we document when we did this, what the site looked like before accessing it, how it flushed. We want to make sure that we know how it flushed. We want to make sure that we chart if there was blood return or not, how the patient tolerated the procedure. We want to make sure that we document anything that we did as far as drawing blood or hooking up an infusion. And if we hook up the infusion, we want to make sure we document what we're infusing and the time and all that good stuff. And then what kind of dressing as well. Like if we dressed it, we want to make sure that we document the type of dressing that's on there. And that should be about it. Thank you.